So celiac disease is a specific type of immune reaction to certain grains, wheat, barley, and rye. The grains are quite closely related to each other, and they all share a similar protein in them called gluten. And gluten itself is made up of two different types of proteins, predominantly, one of which is called gliadin. Now, most proteins that we eat are broken down into their constituent parts, into their amino acids in the gut. But gliadin is difficult to digest and isn't fully broken down. When the gliadin comes into contact with the cells of the gut in susceptible individuals, it can trigger an immune response as if it's a foreign invader, like a virus or a bacteria, rather than that it's part of food. This triggers a cascade of immunological reactions, and this causes celiac disease. It can occur at any age, and we don't know why it occurs in susceptible people at a particular age. It must be mentioned that there are different types of immune response, and celiac disease is a specific type of immune response to a specific protein and a specific food type. So a lot of people with celiac disease don't know they've got it. It can be a silent disease, but sometimes it can cause symptoms. Gut symptoms can be diarrhea, maybe constipation, unexpected weight loss, abdominal pain, or distension or bloating. And then there are non-gut manifestations. You can get a particular type of rash or mouth ulcers, or sometimes even numb nerve endings or problems coordinating, but that's much rarer. And sometimes it manifests through blood tests. Routine blood tests would show, for example, deficiency in iron or certain vitamins, or abnormal liver function tests. You should get tested for celiac disease if you have any long-standing gastrointestinal upset. The problem with celiac disease is that none of the symptoms or features are specific for celiac disease. They can be caused by many other gastrointestinal or even non-gastrointestinal diseases. And so as part of a panel, celiac testing is usually used. So the treatment for celiac disease is the avoidance of the foods that contain gliadin, which is wheat, barley, and rye. And that's the mainstay of the treatment for this disease. The treatment for celiac disease is the avoidance of the triggers, which are wheat, barley, and rye, and that forms the backbone of treatment.